Hi everyone, welcome to lecture 14. We're going to talk in this lecture about supports needs of persons with intellectual disabilities who have higher IQs. To note here, these individuals still do have an intellectual disability, so they do have an IQ score that meets the assessment criteria. But we're talking about those that have IQs in the 70-ish range, plus or minus the standard error of measure. And while we're going through this, I want you guys then to think about how this population may be more similar to those that may be right on the cusp and don't meet criteria for an intellectual disability diagnosis, or are they more similar to those that have a diagnosis of intellectual disability, even though they also do, but because their IQ score is higher. I want you to think about maybe some of the similarities and differences they might have for those that are right on the cusp and don't meet diagnosis for an intellectual disability diagnosis. So when we're looking about just overall outcomes and data and why it's important to really look at this population specifically, the biggest thing is because those with higher IQs, so right at that 70, compromise almost all of our population, so 80 to 90% of individuals with intellectual disability. And then frequently, we don't know the cause. So individuals with higher IQs that have an intellectual disability, these are more of those just multiple environmental things, biological causes that we don't currently have a good understanding of. And so we don't always know what causes their intellectual disability. Additionally, often they have even more difficulties adapting to their environment and receiving appropriate supports than those with more severe presentations or lower IQs. And so while we're going through this, I want you guys to think about maybe what are some reasons why they have more difficulties adapting to their environment and receiving those appropriate supports. So education. We know that close to 30%, 28.6% of students with intellectual disability leave school early, so they don't graduate. Additionally, only 2% are declassified from special education. This one, while it's really important, it's not as concerning because we know that individuals with intellectual disability, as a product of having their disability, will qualify for special education and most likely need different supports and services throughout their educational career. But we know they should be different depending on their needs as they kind of progress throughout their development. But other individuals with disabilities that receive special education have a much higher rate of being declassified, so no longer needing services. When you're declassified from special education, it doesn't mean that you no longer have a disability. It can, but that's not always the case. But it just says that you no longer need specialized instruction, and sometimes a Section 504 plan can be appropriate. But those with intellectual disabilities with higher IQs, we know, are declassified at a much lower rate. Additionally, there's 25% more likely to be African American. This has been a continuous problem that we've kind of seen throughout history, that specifically African American males are classified as having an intellectual disability at a much higher rate. And so it's really important here that we take time to reflect on our assessment practices and making sure that they're fair and appropriate for all populations, so that certain minority populations aren't overly representative or represented in this category. When we're looking about socioeconomic status, we know the proportion of single-parent households among individuals with developmental disabilities is 2 times that of other family households, which when we have single-parent households and maybe only one income, socioeconomic status is usually lower, and there's less income, which can lead to less availability for just support socially, emotionally, and also financially. So employment, we know that they're less likely than those with just a learning disability to get a job. We know that getting a job and having employment is important, not only financially, but also just emotionally, and having a sense of really taking that self-determination piece into account and leading to greater autonomy if individuals can get a job. Unemployment rate is more than 2 times the national average for individuals with intellectual disabilities and higher IQs. Housing, the majority of youth with disabilities still live at home 2 years post high school, And we've talked a little bit about this in previous lectures, but the health issue. So we know that there are higher rates of obesity, poor nutrition, and hospitalizations for longer periods of time, in addition to accidental death or death that could have been prevented with individuals with intellectual disability. So looking kind of at friendship and social behavior, boys or males with intellectual disabilities that have higher IQs have been reported to exhibit antisocial and delinquent behavior more frequently than those with more severe presentation. Family well-being, we've kind of mentioned this before, but almost half of adults with intellectual disabilities still live with their families instead of on their own or with a partner. And that's why the family considerations and looking at disability through a family systems model is so important. Additionally, individuals with intellectual disabilities and higher IQs have a greater tendency to reject services associated with intellectual disability. And this is important to note because a frequent kind of question that folks ask is always, well, do folks ever, do people ever try to act as though they have an intellectual disability or kind of fake having it so they can get services? And with this population, we actually see the opposite. Because of the stigma kind of around having an intellectual disability or previously mental retardation, most folks, again, that are especially that have higher IQs tend to reject services, which then can lead to poor outcomes overall because we know that they need services in order to maximize their human functioning. But if they reject services or don't take advantage of them, as should be as is allowed, then we can see poor outcomes overall. Okay, social judgment. We're going to talk a little bit about this piece because it's really, your book talks a lot about, again, this cloak of competence that individuals with intellectual disability will wear. So kind of this trying to pass as quote unquote normal or typical or not having a disability. And we know that individuals with intellectual disability and higher IQs are vulnerable to risks, and sometimes due to having inadequate response systems, difficulties in interpersonal competence and social judgment and decision-making skills can put them in some situations that put them at greater risk for being taken advantage of or being coerced or tricked or kind of get them to do things that they maybe shouldn't do, so sometimes illegal things. And some have argued that certain aspects of the characteristics of intellectual disability may represent the socialization process and may sometimes be viewed as adaptive responses to their stigmatizing or deficient environments. So when we're looking a little more at that in this inadequate social responding and judgment, we see this kind of denial or necessity for passing, so wanting to, again, pass for normal. Additionally, with this population, a common characteristic is this desire to please, so being very agreeable, so just kind of agreeing with what folks are asking them. And this plays into that gullibility and naivete or being suggestible. And again, these are the pieces that really can make it difficult sometimes during, early or later adolescence or early adulthood, where sometimes their non-disabled peers may take advantage of them and get them maybe to do certain illegal things or kind of take the fall for certain things. So it's really important, we're going to talk about here about education and really early on making sure, since we know that there's difficulty in thinking and learning as a product of having an intellectual disability, that as early as possible, we really focus on these kind of life social skills that we need, these skills that we have to make sure that to the greatest extent possible, they're not tricked or coerced or suggested or taken advantage of again. And this can kind of come in the way of education through school. There are some also programs that focus on reproductive and sexual health with this population. But we know it's really important that the earlier on we can address these skill deficits early on and give them education, the better the outcomes can be. But even then, we know that there can be more difficulty in applying these skills in times of ambiguity or stress. So in real life situations when they may need to use this social kind of thinking and problem solving, while they may be able to be taught in an isolated in an isolated setting, it can be difficult to apply those in the moment. And so now thinking, I'd asked you guys at the beginning, why do you think that maybe individuals with intellectual disabilities with higher IQs, why do you think they have more difficulties adapting to their environment and receiving appropriate supports? Looking at all this information now, and especially really understanding, this a lot of times denial of the disability or wanting to please or pass for normal, a lot of times, again, that leads to rejection of services, and then they don't get the appropriate supports, and then outcomes can be much poorer than they would have been if we had appropriately matched supports. Additionally, I think it's important when we're thinking about individuals that have a diagnosis, that are right at that cusp, so right at that 70. Also think about those individuals that maybe have a very similar IQ but don't meet full criteria for a diagnosis. How is this population more alike or not alike than this population? So say, for example, somebody has an IQ score of 70, but they don't have any deficits in adaptive behavior, or they don't have enough deficits of adaptive behavior. Are they more alike our individuals at the margin that do meet criteria than those that don't, that aren't? I think it's really important to kind of consider this. And this, I think it's time to maybe think about, is it beneficial to have a separate diagnosis for individuals at the margins? Maybe raising our IQ score, maybe just a little bit, so it reflects deficits in IQ, but maybe not as much in adaptive behavior. And if we're thinking about these individuals at the margin, again, is it beneficial to have a separate diagnosis that maybe encompasses more individuals? So they do receive services. And then if that's the case, how do you think the assessment criteria should differ? And how should the diagnostic criteria differ? And maybe it shouldn't at all. I don't know. It's just a little bit of food for thought for you guys when we're thinking about this population, because we know that they're at risk for so many things that we kind of just talked about. So let me know if you have any questions or need any clarification. Thanks for your attention.